Bronchiectasis is a lung disease in which enlarged airways are thickened and/or scarred. This can lead to mucus building up in the lungs. When mucus is not able to be cleared from the lungs, this may lead to infections, which in turn causes more lung damage. Normal lungs have systems in place which clear the lungs and airways of mucus. In healthy lungs, tiny hair-like structures called cilia move mucus out of the small airways and into the large airways, and then into the throat. Once the mucus is in the throat, the person can cough, sneeze, or clear his throat to get rid of the mucus. In people who have bronchiectasis, the cilia do not move as well as they should. This leads to mucus building up in the airways. Failure to clear the mucus can lead to bacteria increasing in number. Bacterial growth can cause infections. When an infection occurs, it can damage the airway and cause a worsening of the disease. Symptoms of bronchiectasis include frequent coughing, sputum production, breathlessness, repeat chest infections, increased tiredness, unexplained fever, chills, sweats, and weight loss, and chest pain. Bronchiectasis is typically diagnosed by high-resolution computer tomography, or HRCT scan. This is a form of X-ray which gives very detailed pictures of the lungs. The images will show the location of the disease within the lungs and the extent of the lung damage. Other tests which may be helpful include pulmonary function tests, or PFTs. These are breathing tests which measure how well the lungs work. Sputum sample. A sample of the mucus from the lungs is collected and analyzed to see if any abnormal bacteria or fungi are present. Blood sample. Blood tests may be used to help identify medical problems which can either cause or increase the risk of bronchiectasis. Bronchiectasis is not contagious. It cannot be passed from person to person. About half of all people who develop bronchiectasis do not have a known cause for the disease. When a cause is unknown, it is called idiopathic. Other causes include infectious diseases such as pneumonia, inflammatory diseases such as inflammatory bowel disease, allergic diseases such as allergic bronchopulmonary aspergillosis, cystic fibrosis, and primary ciliary dyskinesia, or PCD. There are two key parts to proper treatment. First, it is important to remove mucus from the airways. This is called airway clearance. The second part of treatment is to treat infections. Airway clearance. It is important to keep the sputum moving up and out of the lungs to avoid the mucus from pooling and causing infections. Airway clearance methods include manual airway clearance techniques, airway clearance devices, medicines, aerobic exercise, and keeping hydrated. Treating infections with proper medicine is vital. The process includes collecting a sputum sample to find out which bacteria, fungi, or microbacteria may be present in the airway. Once it is known which microbes may be causing the infection, the appropriate medicine can be administered. Some medical providers test the sputum as often as every 3 months, even if the person is not sick. This allows the medical provider to monitor what germs may be growing in the mucus, which may require treatment. An exacerbation occurs when the bronchiectasis suddenly gets worse and makes the person sick. This is often called a flare-up. Treatment for flare-ups may differ from infections. It may need a longer course of antibiotics or a combination of antibiotics. There is no cure for bronchiectasis, but it can be treated. It is important for a person to work closely with his healthcare provider to find the best treatment plan. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye. This video is dedicated to my dear friend Barbara. She has bronchiectasis. She has had many ups and downs with the medical condition. I am so glad over the years she has shared so much information with me. For all her kindness, I wanted to make a video which explained her medical condition.